pandemic. A public health and economic crisis of this magnitude requires a thoughtful and coordinated approach. With the formation of the COVID-19 Recovery Office, we will ensure that our city government is recovering its costs and maximizing the effectiveness of the numerous federal and state grants coming to Philadelphia. The mission of the COVID-19 Recovery Office is to provide a collaborative work structure to ensure that Philadelphia is maximizing opportunities to recover its costs and stabilize its economy while supporting city departments in their work. The office will ensure that recovery efforts adhere to 5 core values. One is accessibility. We will present our work transparently and clearly so everyone can understand the process and substance. We will work with urgency, but carefully and efficiently without duplication of effort. We will be accountable for delivering. Another core value is equity. We will support our city's historically disadvantaged communities to address inequities and ensure that all Philadelphians can recover and thrive after the pandemic. We are also committed to using data to inform decisions, measure progress, and achieve maximum available reimbursement related to COVID-19 costs. The 5th core value of this effort is integrity. We vow to follow all rules and guidelines, act with honesty, and always work in the best interest of the city as a whole. The Recovery Office is chaired by Deputy Finance Director Sarah DeWolf and Deputy Managing Director Chris Roop. They have joined us on today's call if you have questions. By forming this Recovery Office and having Sarah and Chris lead it, we are confident that we will be well positioned to take advantage of the resources that Washington and Harrisburg have provided to help us manage through this crisis. Next steps for the office include continuing to track federal legislation and grant awards and guidance from state and federal agencies, working with operating departments and key stakeholders to coordinate grant applications, ensuring that program design and critical decisions are made through an equity lens, continuing and increasing engagement with key stakeholders, including City Council, through working groups to ensure alignment between the city's response to our funding opportunities and the needs of our communities. Additional details about COVID-19 Recovery Office are available at phila.gov/recover-PHL. That's phila.gov/recover-PHL. That site will be regularly updated with information about available resources and reports on how the city is utilizing its grants to support a successful recovery. Visit the site now to sign up for email updates as well. Again, it's phila.gov/recover-PHL. As we move forward with this, I continue to urge federal lawmakers to move quickly on further funding for Philadelphia and other cities that face immediate and, in some cases, overwhelming needs. While I'm grateful for the help that has been provided to help the city recover its cost, we call on our lawmakers in Washington to take further action. With this assistance, we can ensure that Philadelphia is best positioned to recover from this pandemic and thrive in the years ahead. As we all know, rebuilding our economy must be a priority for Philadelphia and communities across the country as we move from responding to the immediate public health crisis to long-term recovery. Back in March, the city and PIDC launched the Philadelphia COVID-19 Small Business Relief Fund to support Philadelphia's small businesses, help maintain payroll obligations, and preserve jobs impacted by the pandemic. The need was clear, with the fund receiving more than 7,200 applications. Today, I'm happy to share that all of the allocated funding for this program will be awarded to a total of 2,083 Philadelphia small businesses. Because of the Small Business Relief Fund, $13.3 million will go to these local businesses and help them weather the storm as we continue under a stay-at-home order and begin to prepare for a phased reopening. The businesses that receive awards stretch across Philadelphia, with 56% located in low to moderate income census tracts. According to self-reported demographic information, 60% of the awards went to minority business owners, while 32% went to women-owned businesses. While we are proud of the support we've been able to provide to our neighborhood businesses so far, it's clear that our business community needs access to more resources. We will continue to advocate at the state and federal level to ensure Philadelphia receives the economic support needed to recover. Before I turn it over to Dr. Farley, I wanted to note an unfortunate milestone. With today's update, the number of people who have died from COVID-19 in Philadelphia exceeds 1,000. Dr. Farley will have specifics in a moment, but I wanted to extend my condolences to all the many family members and friends of those who lost their lives to this terrible virus. In the last several days, Dr. Farley has characterized the city as being on the downslope of the pandemic. But crossing the threshold of 1,000 deaths is a stark reminder of the need to stay vigilant about social distancing practices. So remember, stay at home, wear a face covering when you have to go out, and stay safe. Now, Dr. Farley, please give us your daily update.
Thank you, Mayor. We're continuing to make progress against the coronavirus epidemic here in Philadelphia. Since this time yesterday, we've had 314 new cases confirmed, bringing us to a total of 19,093 since the beginning of the epidemic. The trend in number of new cases is clearly downward. It wasn't long ago that we were reporting between 500 and 600 cases a day. So this week it's more averaging closer to 300. That's clearly major progress. We're also seeing progress in our congregate settings where it's been the highest risk. If you look at our website, you can see a graph of the number of cases in nursing home residents, and that trend is clearly downward there as well. And in the city's jail, we have 0 new cases to report in inmates since this time yesterday. Likewise, in our city's hospital, we have fewer inpatients. This morning, there were 720 inpatients in Philadelphia hospitals and 1,313 in hospitals in the Southeast Pennsylvania region. That's been going down for about 9 straight days there. So clearly, we're past the peak in the hospitals, and that means we have capacity if there were to have another flare-up. There's also a new graph on our website just to remind people of the number of hospital admissions. It's the number of people admitted to hospitals each day. And that's another good way of tracking the epidemic. And you can clearly see a peak right around the middle of April, and we've been on the downslope since then. Now, since this time yesterday, we've had 22 new deaths confirmed from the coronavirus infection in Philadelphia residents, bringing us to a total of 1,008. And as the mayor said, that is really a very sad milestone. And it's something I don't want to minimize. 1,000 deaths is many deaths. That's happened in just a few weeks, and that's almost as many deaths as we have from the opioid crisis over the period of an entire year. If there's any consolation, the number of new deaths per day is clearly downward. We're clearly making progress. And it is absolutely clear that if we had not taken the steps we're taking now, deaths would have been far, far higher. The people at the Drexel Urban Health Collaborative, using a model developed by other researchers, estimated how many deaths we prevented and will be preventing from our social distancing actions that we're doing right now. And they came up with the estimate in the first 45 days it prevented 6,200 deaths. Now, you could argue about the exact number here, but it's very clear that the actions we're taking are preventing many, many deaths, and we need to continue to do that in order to prevent more deaths in the future. It's also worth, while we're talking about these numbers, to just stop for a minute. Every day here I come and I talk about the numbers. I recognize that this are not just numbers, that those are people. Each death there represents a person with a family, friends, people who will experience that loss permanently. And I don't want to minimize that. We do need to track the numbers. We want the number to minimize the numbers, but we never forget that there are people behind those numbers. Testing for the coronavirus infection continues to be more widely available. Almost every day we have new sites that are opening up. Just go to our website. There's a long list of sites that are available with phone numbers. If you want to be tested, this testing is for anybody who has symptoms of a respiratory infection. Just go in and you can get a test for free. Overall, I would say we're, as I said, clearly making progress on this. However, the fact that we're still seeing 300 cases in a single day means that the virus is out there. We know that there are many cases that we're not diagnosing. So it's still far too early for us to really be talking about opening up the city. We are not going to be doing that now, but we can prepare for that in the future. So as I said before, just be prepared. The virus is going to be with us a long time. People are going to have to be wearing masks. They're going to have to be keeping their distance, and they're going to have to be washing their hands. And just a thought on wearing masks. You know, what wearing masks does is it somewhat protects you, but more protects the people around you. So this is what we can all do for each other, is to wear masks so that we don't spread the infection that we might not know that we have to other people. My mask protects you, your mask protects me. We're going to have to continue to do that if we want to be able to restart our economy safely. For more information, www.phila.gov/COVID or 1-800-722-7112. Thanks.
Thank you, Dr. Farley. We are now going to move to Armando, who will deliver a Spanish language translation of both the mayor and Dr. Farley's remarks. Armando.
Mensaje del alcalde Jim Kenney para el jueves 14 de mayo del 2020. Buenas tardes a todos. Hoy estoy anunciando públicamente que mi administración ha establecido la Oficina de Recuperación del COVID-19. Este Es un esfuerzo coordinado de la ciudad para asegurar que los dólares federales disponibles para Filadelfia sean utilizados para una amplia gama de necesidades causadas por la pandemia. Una crisis de salud pública y económica de esta magnitud requiere un enfoque reflexivo y coordinado. Con la formación de la Oficina de Recuperación del COVID-19, nos aseguraremos de que nuestro gobierno municipal recupere sus ingresos y maximice la efectividad de las numerosas subvenciones federales y estatales que llegan a Filadelfia. La misión de la Oficina de Recuperación del COVID-19 es de proporcionar una estructura de trabajo colaborativo para garantizar que Filadelfia maximice las oportunidades para recuperar sus ingresos y recuperar sus costos para estabilizar su economía, mientras apoya a los departamentos de la ciudad en su trabajo. La oficina garantizará que los esfuerzos de recuperación se adhieran a 5 valores fundamentales. Accesibilidad. Presenten nuestro trabajo de forma transparente y clara para que todos puedan comprender el proceso. Eficiencia. Trabajar con urgencia, pero con cuidado y eficiencia sin duplicación de esfuerzos. Ser responsable de la entrega. Equidad. Apoyar a las comunidades históricamente desfavorecidas de nuestra ciudad para abordar las desigualdades y garantizar que todos los habitantes de Filadelfia puedan recuperarse y prosperar después de esta pandemia. Impacto. Utilizar los datos para tomar decisiones informadas, medir el progreso y lograr el reembolso máximo disponible relacionado con los costos del COVID-19 para que los residentes, empleadores y el gobierno de Filadelfia puedan recuperarse con éxito. Integridad. Seguir todas las reglas y pautas actuando con honestidad y trabajo siempre en beneficio de la ciudad. La Oficina de Recuperación está presidida por la subdirectora de Finanzas, Sarah de Walsh, y el subdirector general, Chris Roop. Ellos están presentes en nuestra conferencia de prensa por si los medios de comunicación tienen preguntas. Al formar esta Oficina de Recuperación y hacer que Sarah y Chris la dirijan, estoy seguro que estaremos bien posicionados para aprovechar los recursos que Washington y Harrisburg le han brindado a Filadelfia para ayudarnos a superar esta crisis. Los próximos pasos de la Oficina de Recuperación del COVID-19 incluyen continuar revisando la legislación federal para buscar subvenciones y orientación de agencias estatales y federales, trabajar con departamentos operativos y partes interesadas para coordinar las solicitudes de subvención, asegurar que el diseño de programa y las decisiones críticas se tomen a través de un lente de equidad, un compromiso continuo y aumentado con las partes interesadas clave, incluyendo el ayuntamiento, a través de los grupos de trabajo de recuperación, para garantizar que la respuesta de la ciudad esté alineada a las oportunidades de financiamiento y a las necesidades de nuestras comunidades. Los detalles adicionales sobre la Oficina de Recuperación del COVID-19 están disponibles en fila.gov/recoverphl. Este sitio web se actualizará periódicamente con información sobre los recursos disponibles y los informes sobre cómo la ciudad está utilizando sus subvenciones para apoyar una recuperación exitosa. A medida que avanzamos con esto, sigo exhortando a los legisladores federales para que nos ayuden a obtener más fondos para Filadelfia y otras ciudades que enfrentan necesidades inmediatas y, en algunos casos, abrumadoras. Si bien estoy agradecido por la ayuda que se le ha brindado a la ciudad para recuperar sus ingresos, hacemos un llamado a nuestros legisladores en Washington para que tomen medidas adicionales. Con esta asistencia, podemos garantizar que Filadelfia esté mejor posicionada para recuperarse de esta pandemia y prosperar en el futuro. Como todos sabemos, la reconstrucción de nuestra economía debe ser una prioridad para Filadelfia y para las comunidades de todo el país a medida que pasamos de responder a la crisis inmediata a la recuperación a largo plazo. En marzo, la ciudad y el PEDC lanzaron el Fondo de Ayuda para Pequeñas Empresas COVID-19 para ayudar a las pequeñas empresas a mantener sus obligaciones de nómina, así como para preservar los empleos afectados por la pandemia. La necesidad era clara. El fondo recibió más de 7,200 solicitudes. Hoy, me complace compartir que un total de 2,083 pequeñas empresas de Filadelfia recibirán financiamiento a través de este programa. Gracias al Fondo de Ayuda para Pequeñas Empresas, $13,300,000 se destinarán a estos negocios locales y los ayudarán a capear la tormenta a medida que continuamos bajo la orden de permanencia en el hogar y comenzamos a prepararnos para una reapertura gradual. Las empresas que recibieron estas subvenciones están ubicadas en Filadelfia y un 56% de ellas están localizadas en zonas de ingresos bajos a moderados. Según la información demográfica proporcionada, el 60% de las subvenciones fueron para propietarios de negocios minoritarios, mientras que el 32% fue asignado para negocios propiedad de mujeres. Si bien estamos orgullosos del apoyo que hemos podido brindarle a las empresas de nuestra ciudad, queda claro que nuestra comunidad empresarial necesita acceso a más recursos. Por lo tanto, continuaremos abogando a nivel estatal y federal para garantizar que Filadelfia reciba el apoyo económico necesario para poder recuperarse. Antes de leer las actualizaciones en materia de salud, quisiera mencionar un hito desafortunado. Lamentablemente, el número de fallecidos por la COVID-19 en Filadelfia supera ya a las 1,000 personas. Proporcionaremos más detalles en un momento, pero quería extender mis condolencias a todos los familiares y amigos de aquellos que perdieron la vida por el virus. Cruzar el umbral de las 1,000 muertes es un claro recordatorio de la necesidad de mantenerse alerta sobre las prácticas de distanciamiento social. Por favor, recuerde quedarse en casa, usar mascarillas al salir y mantenerse a salvo. Y esta es la actualización en materia de salud para el jueves 14 de mayo del 2020. Desde ayer se han confirmado 314 nuevos casos de coronavirus en Filadelfia y actualmente tenemos un total de 19.093 casos en la ciudad. Hay una clara tendencia a la disminución de los casos. Pueden revisar mejor la tendencia en los gráficos que se encuentran en nuestro sitio web. Reportamos también avances en la evolución de los casos en los entornos grupales. Hay una disminución de los casos entre los hogares de ancianos. No reportamos casos nuevos en las cárceles y actualmente tenemos solamente 7 casos confirmados. Hoy también reportamos 22 muertes por la COVID-19 en la ciudad. Hay un total de 1,008 personas que han muerto por el COVID-19 y este es un triste hito. 544 o el 54% de estas muertes han sido en hogares de ancianos. Recordamos que este virus no discrimina por raza o por género. 728 personas han sido hospitalizadas en Filadelfia y 1,313 personas en la región sureste de Pensilvania. Estas cifras nos demuestran un claro descenso. Se ha añadido un nuevo gráfico al sitio web donde se muestra el número de admisiones en los hospitales. Y hemos alcanzado el número máximo de casos a mediados de abril. Desde entonces, los números han ido disminuyendo progresivamente. Las pruebas siguen disponibles con previa cita. Para mayor información, como direcciones o números de teléfono de los centros de prueba, por favor revisar el sitio web fila.gov/COVID-19 bajo la pestaña FAQ. Todas las personas de cualquier edad que presenten síntomas pueden hacerse la prueba del COVID-19. Los datos nos muestran que vamos encaminados en la dirección correcta y hemos visto un gran avance. Sin embargo, hay todavía muchos casos como para reabrir la ciudad. Lo ideal sería erradicar el virus, pero lamentablemente el virus permanecerá en el ambiente hasta que se consiga una vacuna. Cuando podamos mantener el virus en sus niveles más bajos, vamos a poder reiniciar actividades. Hacerlo antes no es posible. Podemos prepararnos para la reapertura desde este momento, sin embargo. Debemos acostumbrarnos a usar mascarillas al salir de nuestro hogar, a mantener la distancia social y a lavarnos las manos. Mi máscara te protege a ti, tu máscara me protege a mí. Juntos podemos superar este gran reto. Gracias.
Thank you, Armando. We will now move to our Q&A portion for members of the media. I would like to ask our speakers and everyone else who's joining us for Q&A now to join us again with your video and audio. Please remember, we do have limited time for these briefings, so only one representative from each media outlet is permitted to ask questions. Reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. For those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video and to ask your question if you are able for broadcasting purposes. We will now unmute reporters one by one to ask questions, starting with Cheryl Spreitzer of 6ABC. Cheryl?
Hi there, can you see me?
Yes, thank you.
Hi, this question is for the mayor. As part of the recovery effort that you just mentioned, we're looking at data that shows Philadelphia has been hardest hit in the 5-county region in terms of unemployment. And part of that is hospitality and leisure showing the biggest unemployment numbers for Philadelphia. How do you foresee the recovery efforts moving forward for those industries in the coming months?
This specific issue is about recovering money that's owed to us for money we put out and for the replacement of dollars that, not revenue, because we don't know whether or not we're going to be able to use it for revenue replacement yet. Hospitality, tourism, and hotels, restaurants, for example, are all going to be dicey and tricky because it not only is based on what the numbers indicate from a data standpoint, but also what kind of consumer confidence is, whether people are going to do conventions anymore, or they're going to do them differently, or are they okay staying in a hotel now as opposed to not. The restaurant industry is even more difficult because what's the spacing, what's the capacity, all these things need to be hashed out with guidance from data, and we expect to do that. Engage members that we have already engaged members of those industries to start preliminary talks about how we can expect to roll out an opening and how do we get from red to yellow to green. So that's really not known at this point, but certainly we understand the impact that hospitality and tourism has on employment and on our economy. And it's a major factor in what we have to deal with getting back to a somewhat normal.
Do you foresee like Philadelphia not bouncing back until some of these industries are back open and running at full capacity?
I think it's going to be difficult if they lag behind because of the factors we just discussed. I think it's going to be difficult to get fully recovered. I don't know if we're ever going to fully recover. I mean, we have the doctor who was fired by Trump I'm not sure what department, what he headed the vaccine effort, said we may have one of the darkest winters in our country's history. So hopefully, knock wood, not, but it all, as Dr. Farley knows and Brian knows, it's day to day, sometimes hour to hour.
So there's no plan in place as of yet for these industries.
We're conducting those conversations. I've had phone conversations with Convention and Visitors Bureau, with people in the hotel industry, people in the restaurant industry, but there's no specific plan yet because we don't know what the data is going to tell us to plan definitively for reopening of all those segments.
Okay, thank you so much.
Thank you, Cheryl. We are going to go to Layla Jones of Billy Penn.
Hello, hi, thank you. My questions are for the mayor. Mayor Kinney, do you think that allowing cocktails to go is a good idea for Philly bars and restaurants?
Yeah, I mean, those folks are suffering. We allow food to go. I see no reason why a jug of margaritas or a jug of cosmopolitans wouldn't help both the bar restaurant owner and the people going home to enjoy a meal and a reasonable drink.
And what do you see as like the potential positives, but also downsides to that?
Downsides is people will drink too much because they're stuck in the house. And the positives is hopefully is that the business will take in a little more revenue and be able to stay afloat until we can figure out how we get our way out of this.
Regarding the new office that you announced earlier for the federal monies, why is an entire new office needed when the administration just cut off some other offices? And I'm wondering, I believe that you all have a grants office already, so I was wondering why they can't handle this.
Well, the grants office staff is really very effective, but small. This is a large undertaking involving hundreds of millions, billions of dollars. And we're going to need all hands and eyes on deck, in addition to some outside professional support to make sure that we maximize every dollar that's available to us and that those dollars get to the right places where people are suffering the most.
Yeah, I'd also like to add, Layla, it's not like we're creating or hiring new staff. Chris was my deputy managing director for policy, and Sarah is a deputy finance director. They're working closely in collaboration with the grants office. So that, don't act like this is an expenditure of resources. This is a redeployment of resources that are 100% focused on making sure we get the most out of our federal grant dollars and that they're applied appropriately, as the mayor indicated.
And there's so many moving parts that we need people to specifically coordinate that.
So there aren't any outside people involved, like you just mentioned?
I believe that there's an RFP out for, which is being reviewed for some kind of outside eyes and expertise to make sure that we're have suspenders and belts on all this.
We're hiring a consultant, but again, every county and every city in the country that I've talked to is hiring someone or has already hired someone in the same capacity.
All right, thank you, that's all.
Great, thank you, Layla. We're going to go to Sean Walsh of the Inquirer now. Sean.
Thanks very much. Dr. Farley, are you seeing, despite the overall positive trend of fewer cases and deaths recently, is there any evidence that that has slowed or ticked back up? I know there's a delay, obviously, with incubation periods, but with reports of more folks going out because the weather is being nice, is there any reason to doubt the optimistic direction of things?
No, if anything, it appears that the decline is accelerating. Now, that's not to say that it will continue. It may very well be that it'll stabilize and we'll see flare-ups, but we haven't seen it yet.
Great, thanks very much. And I think my colleague Laura McChrystal has one question as well. But I guess we can come back on round two.
Okay.
Thanks.
We're going to go to Kennedy Rose of the Philadelphia Business Journal.
Hi, everyone. This is a question for either the mayor or Brian. I was wondering, for the Small Business Relief Fund, I remember that it was initially a $9 million fund with PIDC, and I was just wondering where those additional funds came from to make it a $13 million program.
I believe that was contribution from philanthropy and from business, I believe. Correct me if I'm wrong, Brian.
No, I think that's right, and certainly, Kennedy, we can get back with additional detail as well.
Absolutely. And my second question was, is there any possibility of another round of funding for small businesses? Say, if you get a major contribution from some philanthropist or a different foundation, is there another possibility of there being another small business fund coming around?
Sure, if we get additional dollars, but let me on the small business fund, the additional money was $1.26 million from the private sector, which included Citizens Bank, the Knight Foundation, Truist, which is formerly BB&T Bank, M&T Charitable Foundation, PNC Foundation, the Daniel B. and Florence E. Green Foundation, and over $3 million in repurposed funds from the city and PIDC.
Thank you.
Love my notes. Thank you.
All right, that's all I got. Thanks.
Great, thanks, Kennedy. We're going to go to Laura McChrystal now of the Inquirer.
Hi, Brian, I know that you had said yesterday on the airport situation that the city is working to have a solution and some more shelter space by the end of the month. I understand now that the airport is ready to enforce some restrictions on who can be at the airport starting next Friday. Is it your hope as well that you'll have those homeless individuals out of there by then?
Yes, so we'll have shelter options in place, and we'll be working with outreach and the airport to make sure that those people are relocated to another location.
Okay, and do you still hope that they'll all have shelter beds to go to, and how many folks do you think are at the airport right now?
So right now there's a little over 100 individuals that are sleeping at the airport. We do expect to have enough shelter beds to be able to meet that need as we go through the week. It's not like we've made some of that beds available. We'll continue to make beds available through the rest of the week, and again, do expect that folks will have a place to sleep if they so desire.
Okay, thank you. That's all from me.
Great, thank you, Laura. We're going to move to our second round of questions now, and back to Sean Walsh at the Inquirer. Sean?
Thanks. Just one other question. Mayor, Councilmember Isaiah Thomas has floated a number of proposals to avoid raising taxes, he says, and one of them is to redirect money that is dedicated from the soda tax to rebuild and all the soda tax projects.
I am not in favor of that. We need to maintain our level of input with our young people in pre-K. We can't abandon our education efforts. We'll be even further behind as a city in our poverty numbers if we allow our children to slide back and not be educated. We anticipate having robust conversations with council during the course of the budget process, but like I've been through probably 27 or 28 budgets in my career. You know, and I appreciate the council member's effort on his, I guess, first budget, but we'll have those conversations going forward in the midst of the pandemic, and we'll come up, you know, as I've said, every piece of legislation or budget that's introduced does not come out exactly the way it goes in, and we expect to probably have some changes, but I'm not going to redirect soda tax money, beverage tax money away from our 4 and 5-year-old children to other purposes. We're going to maintain our investment in education as best we can, as long as we can.
Thank you.
Thanks, Sean. We're going to go to Brian Ortiz with the Temple update. Brian?
Hi, good afternoon, Mayor. My question is, does your office or the school district have any plans to help school-age kids keep themselves occupied and fed this summer, since many rely on free public camps and school programs for their lunches and activities?
I believe that I read a story in the paper today that the EBT cards will be distributed by mail to kids. We're working with and talking to our Parks and Recreation folks about hopefully a robust summer program, since the pools will be closed, a robust kind of play street program with meals on a daily basis. And we'll roll that out when the details are finalized. But yeah, we do recognize the need to continue to provide food and other activities to kids, and we're going to keep that commitment.
Thank you.
Thanks, Brian. We're going to go to Denise Clay of the Philadelphia Sunday Sun.
Good morning, everybody. Because the mayor has been talking about looking at budgets and different things through an equity lens. And I wanted to find out, did that necessarily include arts funding? Because from what we're hearing, the African American Museum has had all of its funding zeroed out. Is there any chance of them getting even some of that funding restored, considering that as museums go, this is one that's had problems in the past in terms of staying open?
Well, not just the African American Museum, but just about every institution like that has experienced this dilemma. We will have a robust budget process, and council will collaborate with council. And as I said, no budget or legislation comes out the way it went in, and we'll see what happens in the end. And hopefully we can somewhat address the needs of folks who express that concern.
Okay, thank you. That's it for me.
Thanks, Denise. We're going to go to Martin Pratt of Philly YBN. Martin.
Thank you. This question is for Brian or the mayor. When it comes to taxes, I know last week the mayor said that if a city council member had a different opinion, they should present a plan. When will we get the drill down into the exact numbers that we're expecting the tax increase to hit the actual consumer or the actual homeowner, and the exact way that will impact what departments?
Brian, I know that we've proposed a property tax increase of I think 3.9 something, and that money is not going to the city, it's going to the school district. The school district, we may have to maintain, as we saw back in 2008, 9, and 10, the school district, it was like slashing the budget with a machete. Everything went. And I don't want to do that again to our kids. And we want to maintain as many services as possible for our school children. And that proposed real estate tax increase, however frustrating it may be for everyone, including myself, we need to maintain revenue for our schools so our kids can learn. As far as each department is concerned, we will have that discussion over a shortened period of time with council, and we'll have a product at the end, hopefully, that we're all somewhat happy with, but no one will be totally happy.
Yeah, and I think to your point, Martin, if we decide not to raise taxes or increase those revenue streams, then we'll have to cut departments more. And so I think that's what the mayor's always referenced, is that we need to have a balanced budget. The majority of the budget was balanced on cuts. A small amount was on revenue, but if that revenue doesn't come through, or there's other ideas to replace that revenue or not replace that revenue, then it will increase our budget cuts.
Let me just highlight, which I think is important to understand. In 2008 and 9, there was a $108 million problem. Today, we have a $650 million problem. Of the taxes that are being proposed, that's a $50 million number. So it's a $600 million cut, adjustment, other things other than taxes. So for anyone in the media, I'm not talking to you personally, to say that massive tax increases to balance the budget is totally inaccurate. It's $50 million out of 650. So the other 600 will be dealt with without taxes.
Got it. Now, is there either one? Is there a timetable or a proposed timetable? I know you said when the city council and you have the budget, robust conversation. But are we talking about July, August?
It's got to, we have to pass a budget, I think, by June 30th.
Yeah. So
we, under normal circumstances, would have to have it 30 days sooner so PICA could get it 30 days in advance. But I don't know what the status of that situation is, but certainly by June 30th.
Okay. Thank you.
Thanks, Martin. We're going to go to Rudy Chinchilla with NBC 10.
Hi, guys. I just have one quick question. Given that in New Jersey, beaches are going to start reopening, I think by May 22nd, are you guys concerned at all about people from Philly going down to the shore and, potentially getting infected, coming back, and creating another, surge in cases?
We're worried about, Doc can elaborate from his perspective, but I'm concerned about all of that. I saw in the paper today a picture of a bar in Wisconsin, just hours after the state Supreme Court of Wisconsin overruled the governor on the stay-at-home order. Place was 4 deep at the bar. That is dangerous. And yeah, I am concerned that people will go into other jurisdictions, become infected, and come back and infect other people. I can't remember, Dr. Rice, or I'm sure what his name is, said recently that if we continue to do the direction that we're going and opening up willy-nilly, we're going to wind up having one of the worst winters this country has ever seen in history. And a day at the beach isn't worth that. A seat at the bar isn't worth that. And I think that people have to understand that. I recognize the frustration. And again, that picture in the bar, not one person had a mask on, not one. And I think that's part of the problem. And I ride a bike for exercise or walk down the street with a mask on, and I'm shocked at the number of people that don't have masks on. And we need to continue to pound that away, because that is one of the really simple and easy and unselfish ways to stop this virus. Doc?
Yeah, I'm concerned too. And the only thing I would add is that some people may think that because the number of cases we're having is going down, that we are somehow behind us. The only reason that's going down is because of the social distancing that we're doing. Most of the people in Philadelphia never were exposed to this virus. And if we just start doing what we were doing before, it could be much larger than it was before. We could have a huge second wave. So yes, I am concerned about anybody who's doing group activities without masks.
How are you guys preparing for this? And are you guys at all in communication with officials in New Jersey about, their beaches and Philly residents going there?
I haven't been in touch with anybody at the South Jersey Shore. I don't know whether Doc has talked to anybody in the medical fields in those counties, but.
We haven't. We don't really have control of that. It's a free country. People can go to the beach if they want. But we will continue to tell people that that's risking their own health, and it's risking the health of their neighbors and family members.
And are you guys, like I said, are you guys preparing for a potential second surge of this if indeed, beaches in the Jersey Shore contribute to another spike of cases in Philadelphia?
So we are absolutely preparing for potential setbacks. And I think success equals the fact that we might have setbacks that are small, a little outbreak here or there. We're not going to eliminate the virus. What we're trying to avoid is a huge setback, a big wave of this. And we're preparing for that, but we're hoping not to have that.
Thank you, guys.
Okay.
Thank you, Rudy. We're going to go back to Martin Pratt of Philly YBN.
A follow-up to Rudy's question. I think that one thing I'm looking for from the government is that what we did in the past, I know we discussed this before, but I think it's even more urgent that there is some edict from the city or direction from the Department of Health that if you do leave Philadelphia, you need to self-quarantine. And I don't know, any other way to say this, but you need to put yourself in a place where you're not coming into contact with others. Can we get that from the Department of Health? Because it is a real issue that we're looking at with Delaware and other areas that are coming back to Philly once Memorial Day is over.
I think that there's a misunderstanding that the way that you prevent an epidemic from this spreading is avoiding people from traveling from one area to the other. That's not really what makes a difference. What makes a difference is how close people get to each other. And they can do that irresponsibly here in the city of Philadelphia as well as they can anywhere else. So restricting people's travel from Philly to New Jersey isn't going to make that much difference.
That's not what I'm talking about, and I appreciate that, Doctor. I'm talking about what is the city we said when New York hit the outbreak was if you travel from Philly to New York or you're in New York and coming into Philly, we need you to self-quarantine. And so I think that's a reasonable request that if you're leaving Philadelphia and you're going to partake in all these activities, when you come back into our city, you need to sit down somewhere for 14 days or 7 days or whatever it is. But I think that allowing folks to just think that you can come and go and you don't have any personal responsibility, I think is where the frustration is coming.
We don't have any way of enforcing that. And so all we can do is really communicate to people about that risk. And again, I'm more concerned with communicating the risk that the message that people should be wearing masks wherever they go than I'm saying about don't travel to another place. At the moment, Philadelphia has more cases per capita than the vast majority of places in this country. So if they go elsewhere, they're more likely to take the virus with them than to bring the virus back. So really, it's how you behave every day on an ongoing basis that's more important than an individual travel.
Thank you.
Okay, thanks, Martin. And that concludes all of our questions for today. We will conclude today's briefing and we will see you all back here at 1 tomorrow. Thank you.